So I'll just say good afternoon to everyone. Tonight is the first of our two-part webinar series entitled Let's Talk About Asthma Basics. And this forms part of our Leitrim Library programming under our banner of Healthy Ireland at Your Library. I'd like to welcome Ruth here tonight with us, and I'm delighted to have you here, Ruth, delivering this webinar for us. And Ruth works with the Asthma Society of Ireland as a Respiratory Nurse Specialist. So looking forward to this, Ruth, and I'll just pass it over to you to get started. Thank you.
Thank you, Caroline, and thank you for asking me to facilitate this for you this evening. As you say, it's the first of a two-part series. Next will be next week. We're going to talk about asthma. So tonight we're going to talk about just the different, I suppose, the introduction to it. So what it is, all the different trigger factors. And then next week we're going to talk more about the management and the different medicines and things like that you need first, and how to manage trigger factors. We'll talk a little bit too about trigger factors tonight. So I've just shared my screen here. So I'm just going to get this functioning and start off the slideshow. So also next week, we're going to go through the 5-step rule and the Asthma Action Plan, which most people with asthma should have to manage their asthma. So in the lead up to that, we're going to talk about asthma in general tonight, and how many of the population, things like that are affected by it, and what asthma is about and how it affects your airways. So here we have on the right hand side, you have a picture of your lungs. And obviously this is your main windpipe, dividing down into your different smaller windpipes and into the tiny little ones. And then you have these little air sacs at the end of each of the windpipes. Now remember that your respiratory system starts actually up at your nose. So asthma is now considered what they call a one airway disease, that it affects the lungs and the nose, because in some people, about 85% of people that have asthma actually have hay fever as well. And the two conditions are very closely linked. And I'll be talking a lot about that in the over tonight and next week as well. So basically, asthma is a common condition that causes redness in the airways and swelling of the airways. And there's some pictures later on that will explain this a little bit more detailed for you. The airways, as I said, they're small tubes that carry air in and out of the lungs. And in asthma, then the airways become oversensitive and react to different things. Again, we will talk much more about these later on. That wouldn't normally cause a problem, but these are called trigger factors. So the things like air and dust and pollen, and there's loads of different triggers, and we'll be talking about those in more detail later. So again, if you were to look at those airways, if you see them, that's the normal looking airways. So this actually, when you look at these actually upside down, they actually look like a tree. So this is your tree trunk, is your main airway. And then it divides up into smaller branches, then the bigger branches, then and right into the smaller ones. And then you have the little air sacs, or what looks like leaves at the end of it. So that's, I suppose, just an easier way to explain what the airways look like. Now, if you were actually to take your lungs out of your chest altogether and spread them out over a piece of area, they actually cover a full-size tennis court or a football field. That's how much surface area that's actually in there in your body. And that's how much, as I say, surface area that's actually on the lung tissue. So it's quite a big area. So in terms of asthma then, 380,000 people have asthma in Ireland. And currently, I suppose, that's at the moment, overall, that'll be a mixture of adults and children. And then overall then, 890,000 people will have experienced asthma at some stage of their life, because a lot of children will go out with their asthma. It does stay with some of them for their whole life, but for a lot of children that do actually go out. But remember then as well that it actually can come back in later life, then later on, maybe something to do with a job that they've taken up, or various factors obviously can influence it. So it can be environmental issues, or it could be, as I say, some type of job that they're inhaling different irritants that might actually irritate the airways. So as I said, but approximately there's about 380,000 people living with. So that's quite a lot. 1 in 10 adults actually have children, but also 1 in 5 children have, 1 in 10 children also have asthma. They currently actually have it, and it's estimated then that about 1 in 10 adults have it. And it does cost the state an awful lot of money, in terms of 472 million euros every year. That is in terms of people using different services and medication costs. So it is a very expensive condition, and approximately 8,000 admissions into hospital every year as well, which is quite a lot. One person unfortunately dies every 6 days in Ireland because as a result of their asthma, and you often hear about people dying from their asthma, and there are numerous reasons why this happens. Sometimes it can just be not getting help quick enough, or not recognizing your symptoms whenever you're getting worse, is the biggest problem. Just going back to this again. Yes, so 1 in 6, or 1 every 6 days. Roughly, ED attendances or emergency department attendances is around, there's about 1 every 4 minutes to the accident and emergency department with worsening asthma symptoms. So that's quite a lot as well. So it is a condition that, you can get sick very quickly with it. It's also a condition though that you can manage very well and control it very well. And that's what tonight's all about and next week. So what actually causes asthma? So the exact causes of asthma are unknown, basically. We don't know actually what the real causes are, but it is thought that there is a genetic link. So usually if you have a mother, sister, brother or father that actually has asthma, there's a good chance then that you will get as well. So it's usually a first degree relative that has it. Now they might not necessarily have asthma, they could actually have hay fever or eczema, which is the itchy dry skin. That's actually the same family of conditions as asthma, as is the hay fever. I always describe them as sisters. They're that closely linked. So, you are more at risk of asthma if you have either of those conditions. Or if any of your family members, as I say, your mother, father, brother or sister, if they have any of them, either you're also at risk of getting them. Usually the onset is in childhood, but asthma can actually come on. You can actually develop asthma at any stage of your life. I've diagnosed people in their 60s and 70s and 80s with asthma, never having had it before. So it is a condition that can hit at any stage of the life cycle. If there's a history of allergy or allergic diseases in the family, there is definitely a link and it increases your risk of having asthma as well. So as I say, the hay fever and the eczema, if those conditions are there, or if people have severe nut allergy as well, is another one that's actually a big trigger as well, or can actually maybe lead on to developing asthma. And then unfortunately, our modern lifestyles don't help things and environmental issues don't help things. Unfortunately, Ireland, or Dublin rather, has the highest level of air pollution in Europe. So that increases the amount of asthma in urban areas. So again, our lifestyles in terms of our houses are so airtight nowadays with central heating and double glazing and triple glazing and all the rest of it, that not much air circulates. So that actually increases the chances as well. There's also an increased risk with asthma during pregnancy if you smoke. So continuing to smoke during pregnancy is not obviously advisable for all sorts of reasons, but particularly for the chance of that baby then actually developing asthma after the age of 2 is quite high. Also, if you have children at home and you continue to smoke, that can increase their risk of having asthma as well. So again, even though you go outside to smoke, when you come back in, that smoke is on your clothes and on your breath for up to 4 hours afterwards after one cigarette. So again, that will actually increase the chances too. The latest one on the horizon is that if you're obese or overweight, you have an increased risk of getting asthma as well, and it is now considered a trigger for asthma, obesity and overweight. And then viral respiratory infections. These are all your common colds, and the way children actually get a lot of kind of virally infections during the winter, that actually can increase your risk actually of having asthma as well, or developing asthma at a later stage. So the main symptoms of asthma then, usually it's a cough that won't go away. It usually occurs at night and it's during exercise. That's the one very common one. Now, the other thing to remember is that to have asthma, you have to have at least 2 of these 4 symptoms. If you have just a cough on its own with no wheezing or chest tightness or shortness of breath, well then that more than likely is not asthma. So again, if the cough is a dry cough, waking you up at night, or maybe during exercise, and maybe you're having some wheezing with it, well then that would increase your chances of actually having asthma. Chest tightness then is another one that's a very common one. Sometimes can be overlooked when it comes to asthma. Again, in smaller children or younger children, they might actually complain of a tummy ache because they don't know the difference between their abdomen and their chest really, especially 2 and 3 year olds, so they might actually complain of a tummy ache, so just to pay heed of that. But chest tightness is quite a common symptom, and I'll explain later when we look at the airways why that actually happens. Then wheeze is the other one. So we've all heard of people wheezing, and the wheezing is on the outward breath. It's not on the inward breath. Again, with asthma, it's always on the outward breath. So you can hear this whistling sound of the breath when somebody's actually breathing out. And then the other one then is shortness of breath, which can happen during exercise or even just going up the stairs or just generally not even doing any exertion exercise. Sometimes if you have asthma, that actually can become quite a problem. But again, you have to have it with some of these other symptoms. It can't be just the shortness of breath on its own, because shortness of breath on its own is not asthma, and that needs to be investigated further. So this is what your normal airway looks like. So again, remember, this is if you were to take out one of those airways I was talking about earlier in terms of asthma. You can see the hole here in the middle is actually nice and open. The air gets in and out there with no difficulty whatsoever. These blue parts around the outside of the airway, these are the muscles that surround the outside of the airway. So they're nice and relaxed and not tightened up or anything like that. So when you actually start to get the chest tightness, these actually go into a spasm, like having a cramp. Then you have these little glands then that are in all the airways, and this is not just the big airways. These are what all your airways look like, and they have these glands, and they often, as I said, they're nice and normal looking there. And then you have another muscle layer inside in here as well. So that's all nice and relaxed. So that's what a normal airway looks like. Air gets in and out there, no problem whatsoever. And then this is what happens in asthma. So you have, again, as I said, this is your normal over here on the outside. So you have no muscle tightening, and the lining of the airway is nice and normal. And then in asthma, what happens is that the lining of the airway swells up, becomes very swollen. So that nice open hole there starts to close in and get tight. Sometimes you will have some mucus. Again, usually with asthma, you don't tend to get an awful lot of phlegm or mucus, but sometimes some people will actually cough up a plug of mucus, but it's not like a bronchitis where you constantly have mucus there. This is generally a dry, as I said, the cough is usually a dry cough. And then you have all these little muscles then on the outside of the airway, so they all tighten up. So when you have all this swelling on the inside and you have all this here on the outside tightening up, the air then gets it really hard to get out. So the air gets in all right, but when you actually try to blow out the airway, that's when you hear that wheezing noise. So the coughing actually comes from the inner lining here. So you inhale something, say for example, you inhale a piece of dust or a bit of dust, or you lie down in your bed and you inhale dust off your pillow. And what happens is it irritates this airway. So the little nerve endings in here will actually get all nice and active, and they'll become, as I say, very active, and that will actually make you cough, and it's this dry, constant cough. The shortness of breath is coming from the airway here was nice and open, and now it's not. So again, you're getting a difficulty to get the breath out, and I'd say the wheezing comes from trying to squeeze the air out through that little tiny hole there. And then the chest tightness comes from all these muscles, as I say, going into spasm and tightens up the whole airway. And then as I say, that causes that tightness. And it's like literally getting a cramp in your leg. It's the same thing as the muscles in the chest, on the wall, and in the lungs that are actually going into spasm and tightening up. So as I say, these are just another diagram of this to explain it even more for you. So you can see the muscle bands tightening up there. And here you have the phlegm coming up, and you have the swelling of the lining and everything else. And again, this hole is getting smaller and smaller and smaller. Or a hole is not the technical term. That's actually called the lumen of the lung, or lumen of the airway. But literally it is the small inner hole. And then, as I say, you get difficulty then getting the breath out. So the different triggers then for asthma, and there's loads and loads of different triggers. And this probably isn't going to cover them all, but it'll cover the majority of the most common ones. And anything at all that can set asthma off. So again, for asthma, you don't have to have just one trigger. Most people actually will have a number of these triggers, and these are all the common ones, I guess, that can actually trigger asthma. So there you have smoking that we talked about earlier. And remember that if you smoke, even if you do so outside, it's on your breath and you're closed for 4 hours after you do that. Then you have the animals. These can be dogs and cats and horses in particular as well. Horses can be very high, being a big problem for people that have asthma. But any dogs and cats, they can trigger. And not everybody that has asthma actually has a problem with dogs and cats either. Just remember that they don't actually have, just because you have asthma doesn't mean that's what's going to be your trigger. So again, with people with asthma, we would recommend that you get a short-haired dog variety, or certainly one that does not shed too much hair, like Bichon Frises and Westies and that sort of thing. So they tend to be more asthma-friendly dogs. In relation to cats, it's more to do with the saliva of the cat. That's where the trigger is actually in their saliva, and cats lick themselves all the time to keep themselves clean, and that's why that is a problem. Exercise can be a huge problem, and particularly in the cold air at the moment. Exercise, going out in the cold air, is a huge problem, and the way you can get around that. And one thing about exercise, particularly whenever clubs and that are back training and doing all that usual regular training, it's important that warm-ups and cool downs are done, and it's not just a quick 2-minute warm-up. It really is a good 10 to 15-minute warm-up. If the cold air is triggering it as well, if you put on a snood or a scarf, very light scarf over the mouth and nose, it actually warms the air going into the airways, because the cold air can trigger the airways to tighten up. So again, when you're out exercising, if you're going out for a walk, even just going for a walk will actually kind of trigger some asthma in some people. So again, just make sure that you're nice and warm, keep yourself warm, and as I say, cover your mouth and nose with a snood or a light scarf going out. Don't use a woolly scarf, because there's obviously going to be dust in that and you're going to inhale it, and it could actually trigger your asthma. So use something, a very light one, and that will actually help. It's actually useful too, even to do that in the summertime if the pollen counts are high as well. It actually helps to kind of, stop the pollen getting into the airways. Colds and flus, as I said earlier, they're big triggers as well. And the important thing about those is to know if this is a trigger for you for your asthma, that identify that if you're getting a cold, that you actually act on it quickly and kind of mind yourself and obviously try and prevent. And one thing that has been shown to be very effective in preventing colds and flus is vitamin D. So I would recommend for everybody, whether you have asthma or not, actually to take vitamin D throughout the winter months, because we don't get enough of it from the sunshine, unfortunately, in Ireland. And it does actually help prevent colds and flus, and is very effective against COVID as well. Again, of course, just because you have asthma, just to mention COVID, actually, it does not increase your chances of actually getting asthma. But if you do get if you do get COVID and you have asthma, you may get sicker. So again, but it is really important that you follow the advice of the HSE, and there is actually a section on the Asthma Society website as well in relation to looking after yourself during these times. As I say, your risk of getting asthma is no different than anybody else's. So, but again, people that have severe asthma will probably more than likely get sicker with it. There are some medicines then that actually can trigger asthma. So it is really important that if you are developing symptoms of asthma or you have asthma, you tell your doctor, who may be prescribing other medicines for you. And some of these medicines that are used to treat high blood pressure and heart disease actually will be one of them. Other medicines such as ibuprofen and which is Nurofen. In about 5% of people that have asthma, the Nurofen actually can actually trigger asthma. So again, if you're needing to take something for pain relief, the recommended thing is to take paracetamol first line, and then talk to your pharmacist or your GP about taking anything else if you do have asthma, because it could make your asthma worse. Upset, any feelings like anything, if I've often heard people taking a fit of laughing and they get quite wheezy with it, and you can hear them. Again, upset and stress, all those sort of things, they actually can trigger asthma as well. Dust is a very common trigger, and we all know dust is impossible to get rid of. You can't get rid of it. But there's things you can do obviously to minimize it in your house. So again, not to use furniture polish and dusters for doing your dusting, to use damp cloths for dusting. So you're not actually raising the dust into the atmosphere and then you're not inhaling it. Again, mattress covers and that do help on beds, and duvet kind of protective covers on duvets and pillows are very helpful as well. They do estimate that there's about 10 million house dust mites in a double bed mattress. So again, it's recommended that you actually hoover that once a week. And it's not just good enough hoovering the top of it, unfortunately, you have to flip it over and do the other side as well. So that's quite a bit of a workout. And if somebody has asthma, that actually could trigger symptoms alone, because you are going to be kind of raising a bit of dust. But definitely it is worthwhile putting the mattress cover on. Then we have, and as I say, before we go on to the pollens, the dust, it is impossible to get rid of, but you say keep it as minimal as you can. Again, cleaning products, they're down there, so we'll talk about them in a minute. So pollens then and grass and trees, again, coming into springtime now, these are going to kind of be problematic for some people. So especially in March, you're going to have the tree pollens in March, March, April time. Particularly birch pollen can be quite problematic. I've heard of people living beside a forestry where there's birch trees, or living in a park near birch trees as being quite a problem for them. So again, just something to watch out for. Pollens then, as I said, there's flower pollens and grass pollens. You're going to see them becoming increased in March, sorry, not in March, but in May, June and July, whenever lawns are being cut and the flowers are coming into bloom. So there are things to watch out for as well. So a few tips that with pollens then is that actually if pollen is a big problem for you, what you can do is put some Vaseline on the tip of your nose, and that will actually stop and trap any pollens going up into the nose, and then you're going down into your lungs. So using some, and then using wraparound sunglasses too, actually to stop the pollens going into the eyes. Again, keeping windows open during the day is not a good idea. So certainly if you want to open the windows in the house, open them early in the morning, but close them from 12 o'clock onwards, because pollen starts to fall down in the atmosphere from about 12 o'clock in the day. And as the day goes on, it gets heavier and heavier and heavier. And by evening time, 6 o'clock in the evening, the levels can be quite high. But again, there are pollen trackers available on our website from kind of April, May time, whenever they're launched by the Asthma Society, that you actually can track pollen levels. And most weather casters now actually do provide pollen levels whenever, particularly when the pollen levels are very high, just to warn people about them. Because again, if you have hay fever and asthma, if your hay fever is bothering you, it can actually trigger your asthma and make it worse. So if you have hay fever, it is really important to keep it under control by either using nasal sprays or by using antihistamines. Then we have the cleaning products. So the problem with cleaning products is actually the smell of them. Some of them can be quite pungent and quite strong. And again, something like vinegar and bread soda, and the other thing is lemon. So if you actually use them to clean, rather than actually use products like these, anything that's in a spray gun or like that has Dettol or anything like that in it, because again, as I say, they can actually be huge triggers. And not just any smells really that are actually quite strong. So even, you know, a deodorant spray that's sprayed in a small bathroom, that actually can trigger some asthma symptoms in some people. So again, to use maybe a roll-on instead. But as I said, this one here is actually a big one. The cleaning products is a big trigger. The other one actually can be a very problematic smell is flowers, in lilies in particular. Some flowers actually will struggle big time with lilies, and hairdressers will struggle a lot with different chemicals that they're using in terms of their asthma. So any sprays, yeah, anything like that. So furniture polish, deodorant sprays, some perfumes actually will be problematic for some people as well. Then you have mildew and mold, which are particularly problematic around September, October time. Again, September, October actually is one of the worst times of the year for asthma, as is March, April. So they're the two big times of the year. Now, obviously, asthma can be a problem all year round, but the worst times of the year, and we see that in, you know, in GP appointments and emergency department visits, it does increase definitely around those two times of the year. Primarily, with September, October, it's due to the change in climate and the change in temperature. As well as viruses circulating, and of course schools are open and they're all back in schoolrooms, classrooms again, but also the mildews and the molds can cause a problem also. Food and drinks are actually a harder one to manage and to define, because sometimes, you know, people might think that their asthma, that, you know, certain foods actually might trigger their asthma. Unfortunately, some alcohol can trigger asthma in some adults. Red wine in particular, and some beers actually can trigger. So again, it is a bit of a trial and error. So my advice is that if you do think a certain food or anything is actually triggering your asthma, is cut it out for 3 weeks and reintroduce it 3 weeks later and see does it make a difference. And more often than not, it doesn't. But, you know, so cutting something out for 3 weeks is not going to be problematic. But for some people, you know, it can actually tell them one way or the other if something is, you know, causing a problem. But certainly additives and that in certain foods, like in tomato ketchup and some yogurts and different things like that, might be and could potentially be a problem. The weather, as we said earlier, is a big problem for some people. The cold air, raining, storms, thunderstorms now has been recognised as being another trigger for asthma. So again, you know, sometimes you just have to be watching the weather, and when you're going out, just make sure you're well wrapped up and all the rest of it. And then certain jobs can be a problem as well. So again, you know, this could be carpenters, it could be anybody that's kind of in an environment where they're inhaling strong smells, or in bakeries, that actually can be a problem as well with flour. So again, that's a very specialist area with the job one. So definitely, you know, you need to speak to your GP about that. And you may need a referral to a respiratory physician about that to have that investigated further. For a lot of these triggers, you actually can get a blood test called a specific IgE done to see if actually these triggers are a problem for you. Now, usually, if you can avoid the trigger, and then, you know, for a few weeks, as in say about 3 weeks, and then you kind of expose yourself to it again, that often can tell you very quickly whether you actually have, if that is going to be a trigger for you. But sometimes the blood tests don't always give you the answers, and sometimes they can come back kind of in a grey area. it's not saying yes or no whether you have a problem with that. And this one here for animals, that can be a problem. The other one is the dust is a common one. We can do blood tests also for pollen and grass and trees, and for some foods as well, fishes, milks, cheese. Those are foods that might be a problem for some people. So again, it does help sometimes to get that blood test done. So again, there's no single test on how to diagnose asthma. So at the moment, obviously GPs aren't really open for things like that, but a lot of this can be done over the phone, through a video consultation or a phone consultation with your GP. So again, things they're going to ask you about your family history. This is so important when it comes to actually diagnosing asthma, as is, in the case of a child, what their birth history was, were they premature, and even yourself, if you think you might have asthma, were you born prematurely? Because again, if you were born prematurely, you're at an increased risk of developing asthma also. But as I said earlier, the family history is really important in terms of the atopy and the eczema and the hay fever. Then the pattern of symptoms, that you'll always be asked about those. Is your symptoms more problematic at night time or early morning, particularly with children, because children get up kind of at 5 or 6 o'clock in the morning. So that's sometimes when their symptoms can actually kick in and be a problem for them. Other things to watch out for, with a child as well, is that they're not playing around or running around with their brothers and sisters and keeping up with them, or they're always wanting to be carried and because they feel tired. Those sort of things where we need to watch out for as well. But again, the nighttime symptoms are the big ones. The thing about asthma symptoms is they don't always be there all the time. So, I mean, you could be fine now, and in 2 hours' time, you could be quite wheezy and coughing a lot. That's the way they run. So they're not constant, is the words I'm looking for, in terms of managing symptoms and looking out for them. A chest examination, very often, unless you're actually wheezing a lot at that particular time, your chest examination will be quite normal when the doctor listens to you. So it doesn't often tell us a lot about that. Your peak flow then is the little machine, a little testing or little piece of equipment that the GP might get you to blow into. And lung function testing is the other thing. Now, you have to be over the age of 5 to do either of those tests. But at the moment, actually, these tests aren't being done in the GP surgery because it's not safe to do them. But they can be done. But having said that, we can actually diagnose asthma without actually doing these tests. So don't let that put you off. Then the other thing that often can be done is that a trial of asthma treatment. So very often you might be put onto an inhaler for 6 weeks and taken off it and see does that make a difference to you or not. And that often can help us diagnose it as well. And very often with the way things are at the moment, that is the way asthma is being diagnosed. So I suppose the big important thing is that asthma cannot be cured, but it can be controlled. That's really important. And most people with asthma should be able to live a healthy, active and normal life with minimal amount of symptoms. About 5% of people that have asthma have very severe asthma and will end up going into hospital a lot and maybe attending and going in to see the chest doctor as well in the hospital, and they need specialist treatment. But for the majority of people that have asthma, they can be managed by their GP and their practice nurse. So for next week then, what we're going to do is we're going to cover the inhalers and the medications and just give you some information on that. I go through what an asthma action plan is and how to introduce that and the benefits of actually having one of those. And we will also cover the 5-step rule. The 5-step rule is used to treat an acute asthma attack. A lot of people with asthma, everybody with asthma actually should know all about the 5-step rule. You might never need to use it, but you should know about it and know what to do in that situation, because just because you have asthma does not mean you're going to get an acute asthma attack or a flare-up of your asthma. But at the same time, it's just the in-case thing. You should always know what to do and how to and why you need to do what you do. So this is the phone numbers for the asthma advice line and the beating breathlessness service. So that's the WhatsApp messaging service, which is what I run with the Asthma Society. So you can drop me a text, or it's using WhatsApp. So if you drop me a message on WhatsApp, I can answer any questions for you. And again, which I did forget to say at the beginning of the presentation, was that there is a Q&A session there at the end, or during the presentation, you could pop in your questions in there as well. as I said, the advice line there, both the advice line is actually run by Respiratory Nurse Specialist. So again, you can give that number a ring. It is a free phone number. So give it a ring and you can book an appointment to talk to an asthma nurse specialist about you or your child's asthma. And the Beating Breathlessness WhatsApp service, as you say, is there as well, that we'll get back to you within a few working days with any questions or queries you might have in relation to your asthma. Also, as I say, on the Asthma Society website, which is asthma.ie, you actually can get these numbers there as well. And there's plenty of information there, probably too much information, but there is a lot of information there about COVID and about different things. Our winter wellness guide as well, which is about keeping well during the winter and looking after your asthma. So as I said earlier, we'll talk about managing the asthma next week. So thanks very much for joining us this evening, and hopefully we'll see you again next week.
Thanks, Ruth.